All right, Dell. So why don't we start with telling people a little bit about IPG Health?
Sure. IPG Health is a global ecosystem of healthcare agencies. It's the world's most celebrated and awarded group of those agencies. It's over 6,500 people with over 45 agencies on all 6 continents that are inhabitable.
That's amazing. Yeah, that's incredible. And so I know that you've been on kind of this journey with Domo for a while now, and I know that you actually were using Domo before IPG Health. So maybe tell us a little bit about your history with Domo.
Sure. Yeah. So I had the benefit of having a kind of a trial run in my first company, right? But the honor of bringing Domo to more than one company over time. And in fact, that trial run helped me get my current position at Domo.
I love that. You backstage, you were telling me a little bit about a bus story. Why don't you share that with the audience?
Yeah, so just around the corner here, I was as part of a different products advisory board. And we were talking about measurement and metrics. And it turned out as we were talking, visualizations always make it easier than just talking about numbers all day. So I pulled out the Domo mobile app and showed how we were affecting our processes and using those different technologies. And everyone was just kind of, shocked. Like, how can you possibly have this much power just on your phone and that much insights?
I love it. I love it. So talk to me a little bit about IPG Health and how you guys are using Domo. How many users do you have using Domo on a regular basis?
Yeah, so, we've started with a lot of our internal use cases. And so in there's, thousands of people working on Domo every day to really harness the end-to-end. Because as, we have what we call a healthy obsession with helping our clients improve patient outcome. And so in order to do that, there's a lot of data that you accumulate and need to facilitate those marketing tactics and those interactions. And so every day we're, whether it's operational data or even outward facing to client data, we're really trying to figure out how Domo can better visualize and work with that data.
Yeah. So you brought all that data together like any of the customers here. And maybe you can just give us a little bit more about what the end users are seeing, what they're using within Domo.
Sure, and whether it's the financial components of just understanding how finances accumulate, how our clients, how much things are costing along the way, or even within our applications, that reuse component, because nothing can kill a process faster than having to enter data more than once.
Yeah.
And so for us, our big imperative now is focused on allowing our users, regardless of if it's a custom app or native Domo functionality or coming from an enterprise system, enter that data one time and we're going to reuse it as much as we can.
Yeah, that's awesome. You were talking a little bit about this concept of you used to have to come to meetings and have conversations about data or whatever, and now that has shifted to, maybe tell us a little bit about that.
Sure, and I think we've all experienced it in our careers where you come to a meeting for the grand reveal of whatever that worksheet or that workbook or that presentation is going to tell you that you were measured against for whatever that metric was that's the most focused. But now with Domo and giving that data to everybody at all times, you're really talking about that conversation can happen prior to the meeting. Mm-hmm. So now in the meeting, let's talk about the actions we're taking or the insights that we now have based off of the fact that the metric that was most important is what it is.
Yeah, so I love that. Did you call it the grand reveal?
Grand reveal.
The grand reveal that happens before the meeting. The meeting is to talk about what to do about it.
Right.
Yeah, that's awesome. All right, well, I know we don't have a ton of time. I'd love to just hear what you guys are up to, where you're going, where IPG Health is going. So, how you're going to use Domo. We talked a lot about AI, anything there, but yeah, just would love to hear about the future of how you're leveraging the platform.
Sure, and again, I've been using Domo now for 8 years, right? And when I was on the other side of these lights earlier today, what I heard was, 8 years ago, data science with Domo was an extensive exercise, lots of math, lots of work to really figure out correlation matrices and drawing out charts. And now, whether it's the evolution of AutoML several years ago, or now what equates to 1 to 2 tiles, We're talking about you're taking months of work and now putting it into days, and you're simplifying that into natural language. You can have a conversation and not have to discretely define a p-value or something in a correlation matrix. You're really talking about maximizing that effort. And if you think about for Domo, the fact that that data, my team is a small team. We work to federate and democratize that data out. So now everybody within our ecosystem is set up to have a conversation and get insights based off of the data we've worked so hard to curate and make it consistent.
Yeah, I love that. Well, if you all can do me a favor, I'm trying to convince Dale to come out skiing with me tomorrow. So if you see him in the hall, give him a hard time. You know, maybe measure his feet for his boot size or something. Maybe we can get him out there.
Right, and keep in mind, I'm in Florida, so snow doesn't exist.
Hey, it's cool. We're good with it. Awesome. Well, let's give Dale a round of applause. Thanks so much for coming out today.
Thanks.
Good job. Yeah, that's awesome.